Hello everyone, we are from Group C and we are going to present on the topic changes in pregnancy and testing in pregnancy for our SHP presentation. Here are our group member names listed. Today we will be covering 6 contents. Firstly, we have general changes during pregnancy. Then we will move on to changes in ADME during pregnancy. Next, we will go into the chemistry part, where we will look into female sexual hormones. Then we move on to pregnancy tests. After that, routine tests during pregnancy will follow. Lastly, we will discuss about risks of disorders which are diagnosed by routine tests, ethical dilemmas arising from disorders in fetus, and our role as a pharmacist. Let's start with the case of Mrs. A.
Hi, I'm John, the pharmacist in charge today. How may I help you?
Hi, I just realized that I'm pregnant. It's my first pregnancy, so I'm not sure what to expect during pregnancy. I'm scared that I might do something harmful to my baby without knowing, so I wanted to seek some advices from an expert.
Oh, okay, no problem. Do you want to speak in the consultation room or are you comfortable speaking here?
I would prefer consultation room.
Alright, please follow me. So, how long have you been pregnant?
I just realized this a few days ago, and I would like to have some advices because I heard that pregnant women tend to experience symptoms, and I don't know how to cope with them.
Alright, so to begin with, pregnancy consists of 3 trimesters. In the first trimester, you may experience minor changes such as increase in breast size, loss of sexual drive, and a small increase in body weight. Frequent urge to go to the toilet is a common problem, so try to avoid drinking too much water around bedtime.
Okay.
You may also experience morning sickness, which is basically nausea and vomiting, and it is very normal. But if it gets too severe, please visit your GP. Next, during your second trimester, your weight will increase even more. There may be some heartburn and constipation, so if you cannot tolerate them, you can always come back to the pharmacy for help. As for your blood pressure, it may increase slightly. You will also have some general improvement, such as return of your sex drive and improved skin tone. Morning sickness will also be gone by second trimester.
Alright.
Lastly, for your third trimester, your breathing might become deeper. You will also gain more weight during the third trimester. You'll be able to feel the baby's movement during this time, which is usually a good sign for most women. One thing to take note is that you will be very tired during this time, so I recommend you to take a maternity leave if necessary. These changes occur due to hormonal changes which affect your muscles and growing baby, pressuring parts of your body.
It seems that I'll experience different type of problems.
Yep, but no worries. These symptoms can be managed very easily by adopting to a healthier eating habits such as increase your fiber intake and eating smaller but more frequent meals. Remember to avoid chocolate and fatty or spicy foods, fruit juices, coffee, and of course alcohol. Gentle exercises at home would also be very helpful, but most importantly, take plenty of sleep and rest. Is that okay?
Yeah, alright, that helped me a lot. I'll come back if I have any problems again. Thank you.
No problem. Have a good day, miss.
We have covered most general changes with the case study, so let's go into changes that occur inside the pregnant woman's body in more detail.
To start with, body adapts to meet the increased energy need and extra need of oxygen and nutrients for fetus. Blood volume increases by up to 40 to 50%. Heart rate increases by 10 to 15 beats per minute compared to before. And cardio output also increases by increase in stroke volume. These adaptations are to pump extra blood to fetus in addition to her own organs. Women also breathe deeper and more frequently for more oxygen. Blood pressure also changes during pregnancy. It decreases during first 2 trimesters due to circulation expanding and vasodilation that results from hormonal action. Then it increases at third trimester due to large increase in total body fluid volume and heart pumping blood with larger force. ADME of drugs, which is absorption, distribution, metabolism, and excretion of drugs, are also affected by changes during pregnancy. Thus, we need to look into how pharmacokinetics of drugs is affected. As mentioned before, gut motility is reduced, and it can result in constipation. In addition, gastric pH is increased, and there is more mucus production. Since this can cause delay in gastric emptying, it can lead to nausea and vomiting, which is morning sickness. Drug absorption through oral route would therefore be decreased. In contrast, due to increased tidal volume and increased circulation in the lungs, absorption through inhalation route will be enhanced. Next, plasma concentration of drug will be lower due to increased circulation. However, concentration of free drugs which are highly protein-bound might increase due to displacement of drug from albumin by sexual hormone. Due to CYP450 induction by estrogen and progesterone, some drugs will be more readily metabolized. Those may have to be increased if drug is eliminated by CYP450 or decreased if prodrug is converted into active form by CYP450. Due to increased renal blood flow and urine production, renal clearance of drugs is also increased. Lastly, drug can move from mother's blood to fetus through placenta, and this is a major concern, as drug can harm the baby.
As discussed just now, hormones are responsible for many changes that happen during pregnancy. Hence, we will now talk about the role of sexual hormones during pregnancy.
The first hormone is estrogen. There are 3 types of naturally occurring forms of estrogen in women, which are estrone, estradiol, and estriol. Firstly, estrone is responsible for female sexual development and function, while also acting as a storage hormone. Next is estradiol. It has several functions, which include maturing and maintaining the reproductive system and thickening the uterus lining. Lastly, estriol is produced by the fetus and placenta together. Estriol promotes the growth of uterus and gradually prepares a woman's body for birth. Estrogen are produced mainly in the ovaries when stimulated by follicle-stimulating hormone FSH. Estrogen aid growth of myometrium and increase uterine contractility. Out of the 3 types of estrogen, estriol has the most prominent effect in the body, and it binds to the receptor by hydrogen bonds and van der Waals forces. The next hormone is progesterone. Progesterone is produced by corpus luteum and placenta. It helps to suppress contractility of uterus and other smooth muscles, which helps to prevent too much uterine contraction. It also produces cervical plug to isolate embryo in the uterus, and high levels of progesterone ensures that the anterior pituitary production of luteinizing hormone is suppressed and prevents any other follicles maturing, which prevents miscarriage. Progesterone binds to its receptor through hydrogen bonds and van der Waals forces. It is rapidly metabolized if given orally. Both progesterone and estrogen are steroid hormones that contains 4 fused rings, which are 3 cyclohexane and 1 cyclopentane ring. Both hormones promote development of mammary glands but suppress lactation. Then we have relaxin. It is a peptide hormone produced by the placenta. It contains 2 A chain and B chain, which are covalently linked by 2 interchain and 1 intralinked disulfide bonds. As the name says, it relaxes the uterus and cervical muscles. The next hormone is human chorionic somatomimotropin, which is also called HCS. It is a glycoprotein that is also secreted by the placenta. Its structure and function are similar to prolactin and growth hormone. Its function is to promote development of mammary glands, which are glands in the breast that produce breast milk after birth. Also, it reduces the use of glucose by the mother so that more glucose can go to the fetus. Last but not least, we have the human chorionic gonadotropin, which is also called the HCG. This hormone stimulates LH receptors in corpus luteum and thus has similar activity with LH, which are the production of progesterone and vascularization of endometrium for development of placenta. HCG levels stays high up until the 10th week of pregnancy, and it is used to develop placenta during pregnancy. It is produced by the placenta around 6 to 12 days after conception occurs, and it is excreted in the urine. Due to its nature of being eliminated in the urine, it can be used for pregnancy tests, which is what we will look at next.
Now, we will look at how HCG in urine is detected by pregnancy test kits. There is a pharmacist, Mr. David, and a student in her first year of study for pharmacy course, Alice. One day, Alice gets curious about pregnancy test kits while arranging stock on pharmacy shelf. She asks Mr. David how the pregnancy test kit works.
Mr. David, Since we're kind of free now, can you explain to me how this pregnancy test kit works? I want to have prior knowledge before studying it in university.
Oh yeah, sure. It will involve a bit of antibodies. Is that okay for you?
Yes, I'm fine with that.
Alright, so let's begin. To start with, all pregnancy test kits detect a hormone called human chorionic gonadotropin, HCG, in women's urine. HCG is a hormone which is produced by a woman after she becomes pregnant. HCG can only be detected in plasma 6 to 12 days after pregnancy, as the placenta needs to develop before HCG production can start. If HCG is present in plasma, HCG is excreted with urine from plasma, and all you need to do is to dip the sample pack with urine and you will see the result.
Okay.
The mechanism by which HCG is detected is the use of mobile and immobile antibodies that bind to HCG that are present on the test strip. If mobile antibodies detect the hormone, they bind to the hormone and form antibody-hormone complex, which, when this complex travels down to the test zone, immobilized antibodies in that zone will bind to the hormone of the complex, forming a sandwich structure.
Mm-hmm.
Mobile antibodies have an enzyme on them which can cause color changes in the dye molecules on the test strip. When antibodies all line up at the test line, it forms a colored line.
I see.
Yes, and the excess mobile antibodies are present in the test strip, so the antibodies that have not bound to the HCG before reaching the test zone will not bind to the immobile antibodies in the test zone. Instead, immobilized antibodies in the control zone will bind to those antibodies without hormones, forming a line showing that the test is valid. If there is no line at the control line, it means that the test is invalid.
Okay.
In hospital settings, however, blood tests are also available. Those are more accurate and specific, but more costly and takes longer time. So we usually use the test kit first, then blood tests can be used for confirmation.
Mm-hmm.
As for the cost wise, pregnancy test kit costs around 30 times lower. Confirmation is often done with blood tests because test kit can give false result. Common cause is false positive result are of course are faulty test kits, but it can also be due to ovarian tumor or kidney damage in pregnant women.
Okay, so HCG is only present in pregnant women's urine, and test kit is to detect that using antibodies?
Yes, exactly.
Okay. Alright. Thank you, Mr. David. I'll go back to arrange the stocks on the shelves.
Alright, no problem. If you are tired, you can always take a break at least.
This case study explained how pregnancy testing works. If we know that a woman is pregnant, we need to make sure both the baby and the mother stay safe, and routine tests are essential. We will go back to the case study of Mrs. A, who came back 2 weeks after her first visit to talk about the routine tests during pregnancy.
Hi Miss A, good to see you again. How's your day?
Hi, I'm fine, thank you. I came back to ask what routine tests I need to take during pregnancy, as I do not want to miss them out.
Sure. Do you want to discuss in the consultation room?
Yeah, that would be nice.
Alright, let's go. Okay, let's start. These are the recommended tests to be taken, but you can reject it if you wish to. Firstly, there are simple tests such as BMI calculation, blood pressure check, urine test, and several other blood tests. These are used to make sure that you are not obese, your blood pressure is in range, and your urine has no substances like albumin which shouldn't be there. We will also ask a few questions to assess your risk of diabetes, and if you have high risk of diabetes, we will offer you oral glucose tolerance test or GTT.
Mm-hmm.
In blood tests, we will check your status and your blood group just in case that you need to be given blood, and also to rule out rhesus disease. Additionally, we want to check that you are not suffering from anemia, HIV, Hep B, or syphilis, and make sure that you have rubella immunity.
Okay.
There are ultrasound scans available. Firstly, the 12-week scan, also known as dating scan, will check how many weeks you are pregnant, your expected date of birth, and if you have more than one baby. It can also make sure that the baby is growing at the correct place and pace. We will also offer screening for Down syndrome, Edwards syndrome, Patel syndrome, which are all genetic defects. Screening,
Okay.
yes, screening will involve ultrasound scan, and you can get it during your 12-week scan, If the scan indicates high risk, you will get a diagnostic test to confirm. Lastly, the 20-week scan, also called the mid-pregnancy or anomaly scan, will look at baby's physical development and detects any physical abnormalities. All these tests combined cost around £3,000 in private hospital, but you can get them for free at government hospitals.
Wow, there are a lot to remember though.
Yes, but no worries. I can list them down, all the tests and the information in this paper, so you can refer to it later on.
Okay, thank you so much.
No problem. Have a nice day.
This case study has covered most of the tests. However, there are a few more tests that we will now discuss.
Non-stress tests and contraction stress tests involve monitoring of fetal heart rate during rest and during induced contraction, respectively, to see how fetus copes with the contraction. Next, we will cover diagnostic tests. Firstly, chorionic villus sampling, CVS. It involves taking a sample of placenta tissue. Meanwhile, amniocentesis takes a small sample of amniotic fluid. Both samples contain fetus DNA, and chromosomes are tested to see if there are any genetic defects. Both tests involve syringe, so they're invasive for the fetus. Hence, a non-invasive test would be one way to improve the current test. One newly discovered method is non-invasive prenatal genetic screening test, NIPT, which takes small fragments of fetus DNA, called cell-free DNA, from mother's blood. While there are a number of suggested pros and cons for NIPT from use in private hospitals, we will need more evidence about the use of NIPT before it is used in government hospitals. You can refer to the slide for more information.
Next, we will talk about disorders that can be detected by routine tests.
Firstly, Down syndrome is also called trisomy 21. It causes learning disability and other health conditions, which affect heart, digestive system, hearing and vision, and in many cases it can be treated. In contrast to Down syndromes, adult syndromes, which is trisomy 18, and Peutz syndromes, which is trisomy 13, are likely to kill the baby before birth or very shortly after birth. In rare cases, babies survive until adulthood. Next, Rhesus disease is a condition which can cause anemia or brain damage in the baby, or even death before birth. Normally, it is prevented by anti-immunoglobulin injection during first pregnancy if mother is Rhesus negative and baby is Rhesus positive. If anti-immunoglobulin is not given in such case, sensitization to Rhesus positive blood occurs at her first pregnancy, and if her second baby is also Rhesus positive, antibodies will attack the fetus, resulting in Rhesus disease.
Next, we will look into structural defects of fetus. Firstly, spina bifida is an incomplete closure of the backbone and membranes around the spinal cord. It causes learning difficulties, paralysis of lower parts of the body, deformities of spine, and Arnold-Chiari malformation, where the cerebellum and brainstem extend into the foramen magnum, which is a passage for spinal cord. Next will be the ventricular septal defect, which is when the wall between the right and left ventricles has a hole, causing the blood in the two chambers to mix. Ventricular septal defect can lead to complications such as infective endocarditis, heart failure, pulmonary hypertension, arrhythmia, and valve problem.
If the fetus develops a disorder, ethical dilemmas will arise too. For example, most babies with Edwards syndrome or Peutz syndrome will die before or shortly after birth, and there are questions to be asked. Some examples are: should a pregnant woman be given the choice to abort the baby? Should the baby's autonomy be considered? If the mother does not choose abortion, will it cause the child to suffer even more? Can the family handle the high costs of care in the future? What psychological impact would the baby with genetic defect have on parents? For all these questions, there is no right answer, and whatever decision the parents make, they need to be respected.
As discussed, pregnancy can be a difficult time. As pharmacists, we must assist mother going through pregnancy. To start with, it is important that we educate new mothers about the changes in body they need to expect throughout pregnancy, because unexpected changes are unpleasant. In addition, we need to provide appropriate lifestyle advices and offer treatments for minor ailments, such as morning sickness. Next, we need to inform them about tests that are offered, as they are crucial to ensure nothing goes wrong. Furthermore, we need to prevent any nutrient deficiency in mothers, most notably folic acid, in the first 12 weeks of pregnancy to prevent neural tube defect. Also, we must ensure that mothers are not taking drugs which may harm the fetus. However, if the mother's health would decline without the medicine, risk and benefit need to be weighed. Lastly, it is common for pregnant women to be confused, anxious, or even depressed. Hence, we must mentally assist them in their difficult times.
Here are the 6 key concepts which we would like you to take away from our presentation. Firstly, there are a lot of physical changes that occur throughout the 3 trimesters during pregnancy. Next, there are considerations to be taken into account for the use of drugs due to many changes in ADME inside the body. Other than that, different hormones have distinct functions which work together to support pregnancy. Moving on, pregnancy test works by using antibodies that detect the hormone HCG in women's urine. Various tests are also carried out during pregnancy to make sure that the mother and the fetus are both safe from disorders and health problems. Finally, specific tests can be used to determine disorders in fetus, and ethical dilemmas may arise from the disorders.
That is all from us today. Thank you for watching our video, and we hope you enjoyed it. And we hope to see you again next time. Thank you.